6 and 7. I know you just finished up week 8, so I will make some comments on that hopefully tomorrow and get the video posted for you then. First, on week 6, I know we talked about health literacy, and it's not uncommon that people in the United States are illiterate. Unfortunately, there are still illiterate people in the United States even in 2015, and health literacy is becoming an even bigger problem, particularly with online availability of health information. People Google things and they don't really know what they're talking about because they don't understand the terminology. Then they go to the doctor and ask for prescriptions for medications that they don't know exactly what they do, and it becomes a struggle. So the more we can educate the population, the more we can help them understand health terminology, the better off we will all be. I think that you made some excellent points about the patient responsibility and the patient's privacy, particularly the Health Insurance Portability and Accountability Act. HIPAA is an excellent way to make sure that you are being ethical in the field of health communication. And then we should make an emphasis on the affordability of what a provider recommends. When healthcare providers recommend something, sometimes people cannot afford to do what they are asked to do. It's not that it's their fault they don't comply, it's that something costs too much. So we need to make sure that we understand the difference between socioeconomic statuses or status between physicians and their patients, and how do we help patients communicate that they're not going to follow through with what the physician has required or recommended because they can't afford to do so. It's unfortunate that sometimes people have to choose between their food and their medicine due to costs, and we need to avoid that as much as possible. Asking questions is always a good way to avoid misunderstandings, whether you're in the healthcare field or not, and active listening is just as good for patients and providers, but it is good to have a patient repeat back the information that they have just heard so that you can understand whether they understand what's going on. It is good to treat people personally the way that we would like to be treated, and it doesn't matter our SES or not. Remember, SES stands for socioeconomic status. I have seen people who have lots of money dressed very poorly, so it's always good to just treat every patient like we would want to be treated, almost remembering the golden rule, treat others the way you want to be treated. Bias does, of course, unfortunately exist among caregivers when it comes to socioeconomic status. I have children who are on Medicaid because they were adopted, and the providers frequently will refuse them care or put them at the bottom of the list because they are on Medicaid. Fortunately, when we moved to Minnesota, we were allowed to put them on our insurance with Medicaid as a secondary insurance, so they aren't looked at as poorly as they were back when they just had Medicaid. The providers are more likely to see them now than they did back then. Jumping to conclusion about a patient could lead to a disastrous situation. It's best to treat each patient as an individual with unique differences and experiences. Just as providers don't want to be labeled, patients don't want to be labeled either. Genetic testing is another thing that we talked about, that during week 6 you definitely won't be locked up because you are predisposed to a certain disease, and testing could help prevent you from ever experiencing the illnesses of that disease or the effects of that illness. Or if you have genetic testing, it might help you to deal with the medical issues to which you are predisposed. GINA, the Genetic Information Non-Discrimination Act, is in place. Sometimes there are ways that companies can still get around it using the genetic testing information, but it's not as likely. Plus, it is now against the law, so they have to be very careful if they're going to discriminate against you based on genetic information that they know. Knowing what your children are predisposed to can definitely help you prepare for them and or to help them with whatever disease or illness they might have. My godson and his brother have recently been diagnosed with muscular dystrophy, and so my friend who is their mother, she already knew a lot about kids with muscular dystrophy because her brother had muscular dystrophy. So she spends a lot of time teaching others about MD and taking care of her children and helping them explain what MD is. On another note, it is good to acknowledge any biases that might come from this genetic profiling. That being said, my friend didn't know whether or not for sure her children would have MD, but genetically it ran in their family, so it was always a possibility. It is good, though, to make sure that you talk to people where they're at and focus your medical communication on people where they're at. My godson really wouldn't understand a whole lot if you tried to explain to him about MD. Yes, he's 10 years old, but his brain is not quite that advanced. He does have some learning disabilities based on the muscular dystrophy and likely some attention deficit or attention deficit hyperactivity disorder. So you definitely have to meet people where they're at. When you are working with teenagers, you have to allow your teenager, it's wise as a parent to allow your teenager to develop a relationship with a doctor all on his or her own, so that it's the doctor that they go to ask the questions about sex, about contraceptives, about their health in general, rather than going to their friends to see what their friends have to say about it. Make sure also that you understand that the elderly are part of a individual population. They're not to be screamed at. They're not all hard of hearing. They're not to be babied. They are people with a lot of experience, and it's important to treat them as individuals too. They definitely have special needs, but each individual patient is different. I have some websites I am going to put up for you to take a look at, just in case you are interested in a little bit more about talking to teenagers and a couple other things that we've discussed in this video. Make sure to respect all patients. That's a good idea. And when you talk to children, it is important and challenging when you're talking about healthcare, but nonverbal communication and using terms that kids can understand, those will go a long way. I think that is as much as I want to get across from week 6, and this video already made it to 8 minutes, so I'm going to stop for now and record another one for week 7. I hope you are all having a great time in communication and healthcare class, and of course if you have any questions you can just send me an email, send me a text, give me a call. I will talk to you soon.